Hi guys, Nikki's here. Welcome back to my channel. Today is a very exciting day because guess what? This video is finally here and we've been waiting for this forever and it's finally happening. So Dr. Minhas is finally here. He's in the other room and I'm going to go over and I'm going to start recording the interview, answering all of your questions right now. And I'm having a little bit of a migraine, so excuse me, I might be a little slow, but I'll try my best. So let's get started. Ready?
Hello.
Hi everyone! Welcome back to my channel. So finally he's here, Dr. Osman Minhas, and he's going to answer all of your questions that you sent me. Let's first get started with the introduction. So Dr. Minhas, could you introduce yourself to the viewers?
Well, thanks so much for inviting me to your channel. This is a fun
Thank you
thing
for
to
coming
do.
on.
Yeah, I'm glad to. You know, I've been friends with you and Hubert for a long time, so I'm glad to help out. My name is Osman Minhas. I'm a family medicine physician. I just finished my family medicine residency in upstate New York at Orange Regional Medical Center, and I'm going to be staying on there and working as an attending physician there. So we see a lot of GERD and other, stomach digestive issues in the practice. So, it's a pretty common thing for primary care doctors to see. So I can talk about it and help answer any questions that you guys have as well.
Wonderful. Thank you so much, and we really appreciate that you're travel all the way here to be here with us and answering some of the questions that a lot of them have. And so let's get started. Would you like to start with exactly what is GERD? Because we usually get confused between GERD and acid reflux, and I believe that is similar, right? It's the same thing, kind of.
It's pretty much the same thing. GERD means gastroesophageal reflux disease, and it means when you have so much reflux that it's affecting your quality of life. Because it's normal to have a certain amount of acid reflux in the body, and that's perfectly normal. GERD is kind of when you're getting it too much, it's painful and it's disruptive and it's something that you notice and affects you. And it's basically the reflux of the stomach acid coming up from the stomach and going to the esophagus, and it causes irritation, pain, and discomfort after eating. It can give you symptoms like heartburn that you think of, it can give you symptoms like bad breath. Sometimes people have chest pain that's due to GERD. Some symptoms may be vomiting. People can also get respiratory symptoms like cough or breathing issues with it as well.
Oh wow, I did not know about the breathing problem because I experience a lot of like discomfort on my chest, and also like just feeling like there's always something behind my throat for some reason, but I've gotten much better now. But so pretty much reflux is something more like temporary, right? And then GERD is reflux that stay longer.
I think that's a good way to explain it. Reflux, you can have some reflux after a meal, for example, but GERD is more kind of like chronic reflux, like you keep on having it. So that's,
and it's like comes back, like,
yeah, and it kind of keeps coming back, and you get it with more of a frequency than a person who doesn't have that problem.
Okay, so the first question we're going to start with is, can a primary care doctor diagnose GERD, or do I need to see a specialist?
Yeah, a primary care doctor can definitely diagnose GERD. It's something that's commonly diagnosed in a primary care office. But if you feel that you want to see a specialist, or if you want a second opinion, there's no harm in getting the opinion of a specialist. But GERD is, something that we commonly see in primary offices, and something that a primary care doctor knows how to manage and has a lot of familiarity with.
It's just very common.
It's very common. So primary care doctors deal with it a lot.
So what do you think? Like, at which point, like, say, should I feel like, okay, I should seek a specialist attention?
I think once you've tried to change your dietary habits, and then also you've tried some over-the-counter medications and you haven't really got much response out of doing those things, I think at that point you can ask a primary care doctor.
And do you think that's when your primary care usually also would have that need to like refer you, or it's something that I just decide myself?
In terms of the referral, you can always make an appointment with a specialist right away. As a patient or an individual, you have that right to do that. Typically, with in a primary care setting, the doctor may work with you for a few months, maybe 3 months or 6 months, trying to control your symptoms. And if you don't get much improvement over that period, he might want to refer you at that point.
Thank you. That's very helpful. And the next question is, how much water should people with GERD drink?
So everybody should drink water.
Water is a good thing.
Water is a good thing, and everybody should not feel bad about drinking more water and staying hydrated. It's good for overall health. In terms of the GERD, with drinking water can dilute the stomach acid a little bit, and that can give relief of symptoms. So, for people with GERD, it does help to drink water.
Okay, so should we drink a bit more, or just still like moderate, or whenever you feel like, oh, the acid is coming up?
I think, everybody's a little bit different. And for all the answers, sometimes it's the real answer is what works for you, So you're going to try probably a lot of different things to control your GERD. If water helps you, that's definitely a great thing, and you should continue to use it.
Yeah, you should just try and like see how your body feels, right?
Yeah, I think all these things you can try a lot of these different things, like dietary changes or things like that, or different medications, and find what's right for you.
Exactly. I've been trying to tell them that like in every single videos that everybody is different, so one thing might work for me doesn't mean that it might work for you, so you really have to experience it, like just try. And the best thing, I used to keep like a diary, like of whatever I eat and like how I feel afterward, and that helped a lot with like figuring out like what works for me. But yes, water is good, so drink a lot of water, guys. So next one, can GERD be cured? Everybody wants to know this.
Yeah. I mean, yes, it can be cured. A lot of people can find control over their symptoms either by changing their diet or medication or other means. So a lot of people, can find relief and cure from GERD. But just like any medical problem, that you can't say 100% everybody can find a solution.
Or it could come back, like if you're eating like badly again or so.
Yeah, that's definitely true. If you're very sensitive to certain foods and they triggered your GERD, and then you go back to them, or some of the other practices like smoking or alcohol or gaining weight that can also affect GERD. If those things change again, then the GERD could come back. Yeah, that's right.
And something, actually, I haven't shared this with you, but I am much better now. I'm like 95% normal. I've been eating pretty much anything I want, and but I did stay with that a bland, healthy diet for that whole, like last year, like for more than 12 months actually. Like every single day, everything I eat is pretty much bland, a little salt and sugar, but nothing like spicy, nothing sour, no like coffee, tea, of course no alcohol, and that helps a lot, because just remember from the past, even just one sip of alcohol whenever we go out just like messed up my stomach big time. So that's one thing that is hard to give up for a lot of people, but if you try to just put some effort into it, I'm sure you'll get better. Thank you for answering that question. It's the number one question that everybody wants to know. So let's go on to the next question. It is, what are the long-term complication of GERD? Oh, this is a very important question.
Well, yeah, one of the most serious complications that we think of is something called Barrett's esophagus, and it's basically...
I'll put that name down here so you can see.
It's basically a type of what we call dysplasia or changing of the cells in the cell lining of the lower esophagus, and it basically happens when the cells are exposed to too much acid or irritation over time. They change their shape and they change their form, and they change in a way that leads it to be more at risk for cancer in some cases. So this is not to scare anybody. It's very rare, but it's something that you have to think about in the long term. Like so in terms of the percentage of the risk, maybe less than 10% of people with GERD have the Barrett's esophagus type changes, and people with Barrett's esophagus, they don't have cancer, but they're at more risk of cancer. So they have like something less than 1% risk every year of getting some kind of esophageal.
So do they have to get it checked out every year to make sure?
Yeah, once somebody is diagnosed with Barrett's esophagus, they usually get an endoscopy every couple of years, every 2 to 5 years, and the GI specialist will keep an eye on that and watch out for any changes in that area. But it is a rare complication, but something to be aware of.
And when I looked it up, it said it is like, I think it's called pre-cancer, but pre-cancer doesn't mean you have cancer. It's just you're at risk, higher risk of getting cancer. Okay. Something to pay attention to. Our next question is, are probiotics actually helpful for digestions or in the healing of GERD?
Well, probiotics, this question kind of is more of a bigger question about digestion and not necessarily just about GERD, because probiotics usually affect the large intestine. And what's going on in the large intestine is that you have a lot of bacteria, which are healthy bacteria that colonize the intestinal system. And having the right balance of healthy bacteria in your intestinal system helps you digest food in a proper way. It also may be connected to your immune system. It's an area of science that they're learning a lot more about now. But what we've found and what the research seems to show is that having probiotics, which are healthy bacteria added to your system, helps you have the right balance in your large intestines. So
does it just in overall help with the digestions of like food better?
Well, the one thing that it will really help with is for people who have a lot of gas and bloating. When you have too much bad bacteria, they tend to produce more gas. When you have a good balance of bacteria, the healthy bacteria, and your gut is like in a healthy condition, you will usually produce less gas.
Oh, so
and
less bloating.
Less bloating. And with that, with the connection to GERD, having a lot of gas and bloating can put pressure on the stomach, and the gas kind of goes up, and that pressure eventually will put pressure on the esophagus, and it can have more GERD symptoms.
Oh, I see. So like if you bloated, like that gas could push your stomach, and like the acid could just be going up easier?
It kind of puts pressure on the contents of the stomach, and the contents of the stomach will put pressure on this lower esophagus and have that open up more and be more prone. So, I mean, it's a good example of why like everything in the body is connected. So, staying healthy, in one way is going to connect to everything else, and that should be your goal when trying to stay healthy, is to try to have a holistic approach. Yeah,
not just targeting like one area, but like the whole system, right? And diet is everything, because I've always trying to say this and try to make them see that. But can GERD be passed on to children? Like, I guess she's trying to ask when you're pregnant, like can the child get it?
Or like when I read that question, I was thinking like more like a genetic predisposition.
Oh, that, yeah. You're right.
I think there is a connection. I did read that there is a seems to be a genetic association with GERD. So if somebody if your parents have it, or you're probably more likely to have it too. But another thing is that sometimes we inherit the food habits of our parents, for example, and if the food habits are causing the GERD, that's another way that the GERD is kind of passed on,
Okay. Yeah, I see that. Actually, my mom, I don't know if this might be like an example, but my mom had stomach ulcer. But she've always had problem with like reflux, the acid reflux. She has a lot of acid, and even though now she's like she doesn't have the ulcer anymore, but she still has like in time, depends on what she eats. So certain things she eats like gives her a lot of discomfort. So, and I have GERD, so maybe there's like a connection, like we're just more prone because like, oh, it's genetic. My mom has it, I have it.
Mm. And also, in terms of stomach ulcers can be caused by H. pylori bacteria, and that can be something that can be passed around people you're in close contact with as well, like your family members.
Oh, so like say using the same spoon, for example?
Yeah, or just using the same cutlery or food products around the house seems to be the way that that's passed.
Yeah, I don't know how she got it. Probably just because, you know, she lives in Vietnam, and maybe when she go eat out, and you know the way they prepare food, like you don't know, like maybe she got it from food, but she did have the H. pylori.
Oh, she did?
Yeah, she did. They
Okay.
tested it, and then after that, like she literally had like ulcer, like a hole in her stomach.
Oh yeah, wow.
And it took years for her to finally like get that healed, but still these days, like she can't eat anything sour or acidic. Like it still hurts. I don't know if it's just that like phantom pain or what, but here and there she has to take the antacid or like Prilosec for like several days. But interesting. Okay, so going on to the next question. Next question is, do you recommend taking medication to treat GERD or changing diet?
I think the best thing to do is change your diet. But you know, when you have GERD symptoms, you're going to be very uncomfortable. So there's nothing wrong with taking medication. You can do both at the same time. You know, try to figure out what trigger foods is causing your GERD. You know, we already mentioned the alcohol, coffee can be also an irritant. Caffeine itself, a lot of these foods can cause a relaxation of the lower esophageal sphincter, which is a sphincter right above the stomach. Foods that do that are caffeine, citrus, tomato. Also, really fatty foods can slow the emptying of the stomach and put more pressure on the sphincter as well. So that could be another thing. So, you know, basically all the foods we like, right?
Yeah.
So,
unfortunately.
Yeah. So I think what you were saying, keeping a food diary, that's really helpful, and that's something you can bring to your doctor as well. But it just gives you more awareness of, you know, the foods you're eating that are causing it as well.
And it's really different for each person, because when I did my research about what food is the most like top trigger, and then banana wasn't one of them. But every time I eat banana from the past, like it really gave me really bad reflux, like even sometimes worse than if I eat tomatoes. So
really?
Yeah, I don't know. Really depends on the person. But there's those common foods, like you said, you know, anything acidic, alcohol, coffee, and so on. But I do have a quick question, if you don't mind.
Sure.
So, medication, it really helped me when like the inflammation was really bad, and then when I got better, but then I was still taking the medication just because I feel like I was scared getting off of it. So like, would you recommend doing that at all? Or of course I guess I should have checked with my doctor after, like, because you know they prescribe for a certain amount of time, but then after that, because it's over the counter, I still keep taking it myself.
So yeah, that's a good question. I think in terms of, you know, the research, it shows that the PPI medication, that's the most common one, like Nexium, Prilosec, those medications are the most effective for treating the GERD symptoms. Now, in terms of if you should stay on them for the long term, it's probably not a good idea to stay on them for, you know, more than a few months to help control the symptoms, and then after that, see if you can get off them. They do have some side effects. You know, once again, these are rare side effects, but something to be aware of. They can cause vitamin B12 deficiency in some people. They can make you more predisposed to a C. diff infection, which is an intestinal infection. They can also change your electrolyte balance in the body. And then there's other new research which is showing that they may, in people who take them for very long, like elderly people, they may be connected to other conditions as well. So, you know, overall, we tend to recommend that you're on it for a good period of time to control your symptoms, and then if you're able to get off, that would be the ideal thing.
Right. And then just change your diet, do your best to avoid those foods.
But then again, some people do need them for longer as well.
Is that true for people who have Barrett's esophagus? They have to stay on forever?
Um, I don't think there's a recommendation to stay on forever for Barrett's esophagus. I think for Barrett's it's mostly the monitoring every couple years, which keeps them safe. People, you with Barrett's esophagus, you may or may not have the symptoms associated with it. But I think that's a good question. And if you're unsure about how long to be on a PPI, or you don't get improvement,
Speak to your doctor.
You should, yeah.
Go talk to your doctor. Don't just decide to do this yourself. Awesome, we got a lot of good answer. So next, could an endoscopy hurt the inner lining of the esophagus or your stomach?
So an endoscopy is...
I guess this is upper endoscopy.
Upper endoscopy. So upper endoscopy is a common procedure used by GI specialists to assess any issues with the upper GI tract. They can assess GERD, gastritis, peptic ulcer disease, other conditions as well. And they can also do a biopsy, check for celiac disease. So it's a common procedure. Has a lot of. It's a very valuable procedure for assessing issues. The endoscopy, is very commonly done, but it can cause some irritation of the tract, the esophageal tract, and the stomach. But it's a temporary type of irritation.
Oh, is it because the tool is like when it goes down? Might scrape the
I think
lining?
in some cases it can cause a little bit of scraping of the lining, but the lining in the esophagus and stomach and the GI tract recovers very quickly. So I think it's a beneficial thing to get in cases where it's recommended.
Yeah.
To answer your question, yes, it can cause some typically temporary damage. But like any procedure, it's going to have risks, and there are always cases where any procedure can cause even more severe complications. With the endoscopy and a colonoscopy, you have to go under anesthesia, mild form of anesthesia. So none of these things are risk-free, but for the most part, I think their benefits outweigh the risks, especially when you need help making a diagnosis.
Right. Exactly. The benefits outweighs the risk. So I had my endoscopy, I've only had it done once, but because I just keep having symptoms, and it was like I was on Prilosec for years, but then I was still experiencing symptoms, so my doctor finally recommended we had the endoscopy done. It was great. I didn't really feel anything afterward, or nothing. But yeah, it was really helpful because he was able to get the biopsy of the stomach lining and examine that and said that everything is fine. Nothing is really nothing was damaged or looked like all the cells are working, doing their job. And shortly after that, with the diet, I was strictly just following this very healthy bland diet, no oil, no greasy food and sour or spicy food, and I'm okay now. So, but yeah, of course there's risks, but I had a great experience. So.